right, we are live. Yay. Okay, it's working. Hi, everybody. I'm Dr. Boz. Welcome to Friday mornings. This is a new experiment for me to do this at a much better time for my brain. So I was so happy to see that people logged in and put in questions already because this is a live Q&A. I have had literally thousands of questions, and I have had several of you comment saying, would you answer more questions? I'm like, there are a lot of things to think about when you do this, like a microphone or a little button that wasn't pushed before I started. Anyway, I'm getting the hang of it, and I actually love your questions. It really does show me where the education is bridged and where I should be putting some energy. So first of all, thank you for those of you that totally took away my fear when you wrote in a question early. I actually had prepared a couple of questions of people who had written in, and I am going to save those for just a minute because I have some slides ready for them as well. But there's a few things that I love to do. YouTube is what I consider my new classroom. So if you have followed my story over the last, I got 20 years into this gig of being an internal medicine physician. I love reversing disease. I believe the worst thing of a physician is to getting the patient addicted to the physician. The name of my clinic has been Meaningful Medicine, and when we look at defining that, it means they don't need us anymore. They're a healthy person, and their chronic illness is either really well managed or reversed. So for those of you that are new to my channel or have just tuned in for the last few videos, I'd like to just explain a little bit about what my channel is about. I am an internal medicine physician, and I take care of chronic illnesses. So when people say, what does it mean to be an internist or internal medicine? I tell them I start at puberty, I take them to the grave, and I don't catch babies. So what that has collected over the last 20 years are chronic illnesses. My favorite chronic illness to help somebody manage is if their brain isn't working right. And that has led to depression, that has led, to problems with bipolar, with Parkinson's, with Alzheimer's, with traumatic brain injuries. But then just getting the best performance out of your brain has been something when I say people graduate from my clinic, meaning you can see me once a year or once every few years because you're that healthy. That is a great testimony for their health. But it also means that we got their brain working right and they can manage themselves on their own. So a couple of years ago, I was studying the ketogenic diet in relation to mitochondria in the brain and how it improved not just mental function, but cognitive performance. There was some early study at that time on the reversal of symptoms with Alzheimer's, which I didn't think I'd never seen that before. I've seen it a lot since I've been studying this. But in that process, I decided to go on a ketogenic diet myself. And in that first month, my mother came to me we went to a doctor's appointment. She was being treated for chronic lymphocytic leukemia. She was 10 years into the chase. I'm an expert at chronic illness. And she was saying, I don't like the way this is going. I'm tapping out. So she walked out of the oncology office and said, I don't want to do that chemo. I don't want that third round of chemo. And I turned to my mom in one of the most intimate moments of our adult life and said, Mom, do you want to see what I would do? Do you trust me? And of course she's like, sure. I'm like, no. Do you really trust me? And in that moment, I had learned so much about what happens in the metabolism of cancer cells versus healthy cells. And then just the life she was living had been just so wilted that she went from nearly 180 pounds and 71-year-old dying woman to, by the end of her 73rd year of life, down to 125 pounds, but her cancer had suppressed, her energy was better, and I told her she has permission to die. And that sounds a little rude until you realize she wasn't living before. She was just surviving. And the way you can support this channel is to buy the book any way you can. It is my favorite teaching tool. I actually like the audiobook the best. So, all right, that is what, for those of you that haven't been to my channel, I really do love those of you that have bought the book. I don't have a big publishing company, but I think the book turned out amazing. So if you have bought it, would you leave a comment of what you thought of the book? If you haven't bought it, I would love it if you bought the book. If the number of people that are subscribed to this channel, if a tenth of you bought the book, I would be able to make videos every day. Anyway, all right, so let's get to these questions. I'm going to start with those that were at the top. And so it says, Barb W writes in and she says, I'm 65 in ketosis and has readings of 0.6 ketones daily, and the sugars are still too high. When I look at sugars still too high, I would guess that that's above 100. I do have a few slides here that I'm going to use to teach some of this. So I was reading that comment earlier and knowing that there's a couple of comments in the beginning that go with this. So there's Gina Z, and she said, I ordered a glucose meter. My blood is usually very good, between 80 and 82, sometimes a little bit less, but I'm having a hard time staying in ketosis. All right, so I'm going to show you a slide here that I think does a good job. This is from the data put out by Steve Finney, and I believe it's this one. Yes. Okay. So hopefully you can see that slide, and it says burning fat, exercising by ditching carbs. Actually, what it should say is burning fat by ditching carbs. This was the one that I didn't finish editing. So pretend that top part is gone. But what I want you to show you is if you can see that insulin along the side and the fat burning along the bottom. So we know that people who take that gal Barbara who says I'm 65 and my readings are 0.6 daily. And I'm guessing she means her ketones are 0.6. So in order for the body to burn fat, we need to suppress this insulin. The insulin needs to go down. If you look at this part here, it says no fat burning versus high fat burning. When I tell people to go on the ketogenic diet, like most of the physicians or the coaches out there, they'll say, yep, you should try to hit that 20 carbs per day. We talk about net carbs versus total carbs. I'm talking total carbs per day. It should be 20 or less. And the reason I love them having 20 carbs is that the insulin is usually very low. Many times you don't get that the first day you do 20 carbs or less. It's going to take you 2 or 3 days. But if your ketones were at 0.6 and your sugars are still running high, I look at that as a time where your body is continuing to empty the stored glucose. Stored glucose is called glycogen. Glycogen is in your liver. It's also in your muscle cells. And when you have been living in a time of lots of insulin, high insulin state, those storages cannot empty. They stay there forever and ever and ever and ever. They're meant to be used in the body for times when glucose in the blood is low. But if your glucose in the blood never sinks down, those storage units just sit there. So they're sitting there in the liver, they're sitting there in the muscle. They were put there in hopes to say, oh, we'll just need that in a little bit when they stop eating so many carbs. But that didn't turn out so good. You didn't stop eating carbs long enough for the insulin to sink. And what insulin does is insulin will reduce your the lock and key on those storage units. So then those storage units can open up their fuel. You can now use that in your muscle and your body. And that is the key to reversing these health problems. Is we have all these storage pockets around that have been there for years and years because our insulin was always so high. Now, much better time of if you can get your insulin, if you can get your carbs down to 20 or less, depending on how insulin resistant you are, your sugars will come down. And once those sugars and insulins are down, your storage units can open up. But it leads to some of these other questions too. So let's see. The second, did I answer that question? Let's see. Oh, she had ordered her glucose monitor 80 to 82, but she has a hard time getting into ketosis. So if the sugars are well controlled, but the ketones are low, a couple of things. I want to make sure if you're really kind of that intense about a ketogenic diet that you've moved from the urine dipsticks to the glucometer, the ketone monitor, I mean. The ketones do a lot better job in the blood of measuring what's actually going on. The urine is a wonderful way to begin. I have lots of people that never move past urinary ketone strips because they're in ketosis, they're losing weight, and I'm like, don't go anywhere. Don't put your energy anywhere else if you're having this success. If you get to a plateau, I'll tell you what to do. If this woman has staying in ketosis means that her ketone readings in her blood are lower, it almost always means that you're not having a long enough time where your liver gets to rest every night. And I think this leads to several of these other comments that I was reading before I started, that if you look at what happens inside your liver is supposed to do that. Those pockets of storage are supposed to empty every night. When I ask patients to show me their morning glucose and their morning ketones, what I'm really looking at is how well did they empty out the storage in their liver. And that absolutely depends on how long did you give it. How insulin resistant are you, but you can't change that overnight. What you can change overnight is how many hours did you have nothing through your lips between the morning time when your liver wakes up and subtract, I like at least 10 hours. So some people I push them to 12. So if you look at the 10 to 12 hour fast, I mean it is strictly a fast. It is water and salt only. And that is the other part of that equation is that your liver will wake up with the sun. So it's not quite with the sun, but I use that as a way to say you can't change the sun. People say, but I kept it dark. I'm like, I don't care. Your liver wakes up with the cortisol boost in the morning, and that cortisol starts the enzymes flowing. I fast through that. I fasted through that for a year and said I just didn't eat breakfast. I didn't eat for the first time in a day till I was hungry. I continued to do that for about a year, and I did great. So did most of my patients. When people come in and they're plateaued, though, I push them to say, check out the liver window. The liver window opens every morning about an hour after your cortisol rises. Now back up the timer, and I need nothing in your lips between that time. Okay, let's keep going here. We have lots of questions. I shouldn't have been worried, I guess. All right, so let's see. I'm 70-year-old doing low carb and keto for a year now. Need to lose 7 pounds, and I see 0.3 mostly on my ketone meter. That's plateaued. Yeah, this was one of the other questions I read before I got started too. Again, that plateau says that your glucose reader, your ketone reader is low, but what is your glucose? And that is really, really where this Dr. Boz ratio comes in. I'm going to just show you that equation quick because I think it really helps to teach what is the Dr. Boz ratio. The Dr. Boz ratio came from the literature teaching about the glucose ketone index, but that had a lot of math in it, and most of my patients said, not going to do that. So I calculated it for the American values and used their guidelines to say, well, what is their Dr. Boz ratio? So you take your glucose and you divide it by your ketones, and that gives you a number. And you say, well, why would you care? Well, the reason you care is because of this. So this is the Dr. Boz ratio versus insulin. And that is the lower your Dr. Boz ratio, the lower your insulin. And if you look back at that previous graph slide that I had up earlier, that graph has to do with the lower your carbs, the lower your insulin. But then I hedged. I said, you know what? It can trick you, because if you have insulin, you can go to the lab and check your insulin. You're going to pay them $50. You're going to go to the lab. You're going to have them poke your blood, which is fine. But you need a doctor, and then you need someone to get. Then you're going to have a day before you get the results back, and you're like, oh, what did I do yesterday? Oh, maybe I had that little piece of gummy bear or something. So there's lots of variables, and there's a distance between getting your results. When I think it's even more powerful to approximate their insulin with this ratio. What are the ketones doing? What are the glucose doing? If your insulin is high, your ketones will be super low. Now, your insulin can be high and your sugar can be all over the place, actually, because it depends on what phase you're in. Did you just eat and the insulin's going up? Have you had insulin resistance and you've been making buckets of insulin? So using the two of these numbers, going back to this graph, if the glucose is high and the ketones are pretty high, I see ratios in that 80 to 40 range. When Grandma Rose, the woman I wrote the book about, my mother, was fighting her cancer, we used therapeutic ketogenic diet. Again, she was supervised by a doctor, by me, and we pushed her to a Dr. Boz ratio of 20. What I look at most times for folks when they're stuck in a plateau for weight loss, if you get your Dr. Boz ratio less than 80, you are going to find a metabolism that allows that fat to open up. Those fat cells are trying to be used as fuel. They will be locked until your insulin is low enough. How do you know what your insulin is? Look at your Dr. Boz ratio. So in the show notes, you'll see a glucometer called a FORACARE glucometer. And I know it costs like $100, but it is way cheaper than going to a doctor's office, going to a lab to get your insulin checked, only to say, oh, we did it once. No, you can check your Dr. Boz ratio like 4 times a day. And even it's amazing how much people learn in that when you take the results and you do not get them too far away from their life. Like I used to tell patients, I check your cholesterol 3 times a year, but why the heck would you come in and see me for it? Because the distance between you changing behavior and then getting the results is almost so far apart that you have to be really motivated to want to change behavior. When I check your labs 3 times a year, I need you checking based on the food you ate last night. You know, I had one of the stories that wrote in is just really compelling. And she says, I've been keto, losing weight on keto since October 2018. Then Christmas came and my mom was diagnosed with terminal cancer and put in hospice. I've been her caregiver for 10 years. This is from Kim H. I know my cortisol levels are high. They're through the roof with this high stress. The lack of sleep, I'm sure, is exacerbating this. If it wasn't, let's see. Is there anything I can do to lower the insulin level or lower those cortisol levels? So I wrote her back and said something like, well, tell me where you're at in your journey. And then I said, I'm going to need some good questions for my live. I'm going to do this live. So Kim H, if you're watching, thank you for typing this in. And so she went on to say how she's been keto for several months. She is checking the Dr. Boz ratio, and she's found that when she was not as stressed, the Dr. Boz ratio was in that 80 to 40 range. But when she got stressed, it was much higher. And what can she do about it? If she's like me, during times of stress, I've used carbs to comfort for a long time. That habit comes back really quickly when I get stressed. But what I have learned to do is, and this is not just my opinion, there are several of the research studies saying in the cancer patients where they're trying to get those really good Dr. Boz ratios to suppress that cancer growth, they supplement. They use, I have this one that I have put out. It's a Dr. Boz BHB. It is Ketones-In-A-Can. So you're stressed out. I do not recommend these for everyone. Most people can make ketones on their own. We want your liver practicing that. But when you get stuck in a plateau and you say, I'm about to give up, I'm going to start smoking or drinking or eating carbs again. No, just wait. Take a supplement like that. And so I can think over the last 6 weeks, there's been lots of days of stress in my life too. And I'd like to give up on this, chocolate cake sounds really exciting. But I would take 3 or 4 tablespoons of heavy whipping cream, put in the ketones, mix it in some ice, and then I would sip on it before I would make a bad decision. But what happens is amazing is that my brain, I've been in ketosis now for a couple years, instead of being like irritable and sluggish and slow, suddenly I had a little more energy. And this isn't like the flash energy I would get from sugar. This is the kind of energy that, oh my gosh, 2-3 hours later, you can't feel it wear off because it kind of sparked my body back into doing what I wanted it to do. And so in times of stress, what is happening with the cortisol is it's suppressing your insulin. It's producing insulin. It's suppressing your ketones. And that suppression of ketones leads to this cycle of then they're down, then you get cravings for sugar. If you break that cycle with a little supplement, which is what I do, then I don't end up with the 2 weeks of a bad habit saying I got to start over again. I just feel like crap. So if you've been watching I have a couple of storylines that I'm using on my channel. One might launch today. If we get some editing done, it'll launch today. One of them is on walking through a woman who is pregnant and has been in a ketogenic diet. Then she got pregnant and kind of fell off. And now she's like, I don't feel very good. And my sugars are high in pregnancy, which is really hard on the baby. So we're following her story live. So tune into that series because we actually insert a continuous glucose monitor and unpack how important that would be in a case like hers. So keep an eye on her. If you are a person of faith, just pray for her, because she got a lot on her plate, just trying to get through a pregnancy and not feeling good, and the health of the baby, all that stuff. So the other storyline that I've been following is a type 1 diabetic. In fairness, this woman is a pet project of mine. I love her. She has been on my favorite list of life for over 5 years. And her type 1, actually more than that, I diagnosed her, which was 7 years ago. So, and she was in her 30s with type 1 diabetes. So that's a weird presentation, but bragging points, I nailed it on the first visit. I'm like, I bet she has type 1 diabetes. I ordered the antibodies, proved that she had type 1 diabetes. And then, that's really tough to take. So she has been on the show now every Sunday for, I think we're at 6 weeks. And she just had a huge breakthrough this week, so I can't wait to share that on Sunday. But in her case, it took over 3 weeks of twice a day supplementing with Ketones-In-A-Can to get her body ready to use ketones. And she's had some awesome breakthroughs, which it was hard to keep saying, hang in there, hang in there. But boy, it really has shown to improve a lot of things in her metabolism. And that's why I'm saying, when you hit a plateau, there are some really intense things we can do, and we'll go through those in just a minute. But what I've learned is that if you can biohack the chemistry of somebody who's struggling, that's the time to use supplements. I've taken care of brains that don't work, which translation, that means there's addiction all over the place in my practice, from heroin to cocaine to all kinds of carbs are an addiction. It's the easiest translation for my practice is to say, this is what we do with an alcoholic, and this is what I'm going to do with my carb addicted patients, is that when you're in a moment where you're about to lose it, you're about to fail, let me help you. Use this supplement of Ketones-In-A-Can. We make them in the chemistry lab. We do put some sugar substitutes in there because they are pretty gnarly tasting. They're a salt. I make sure that the one I produce is mixed with magnesium, because everybody's low on magnesium, and the supplement, any place you can add magnesium, that's a major, major improvement for everybody's brain. But also, if you're keto, you'll tend to lower your magnesium when you first start keto. All right, let's keep going here. We're going to be here for 10 hours if I look at all these questions. Okay, I like this, so don't stop typing. Let's see. So let's see. I am wondering what the calories are in your exogenous ketones. Oh, okay, that's a great one. So again, calories are a form of energy, and ketones are a calorie. I do see that on the label. We did not put that, and I forgot. That's me. The next one we're going to print is going to have the calories on there. But there were five calories per dose. So that's that the supplement that's in that one is the stevia too. So what is the best way to clear out your liver when to get it functioning more optimally? Okay, so this is a great question, because if you've read my book, I do a whole chapter on this. For those of you that haven't read the book, it really does A, support this channel, but B, it is my favorite teaching tool. These are the lessons I took to my mom, saying, Mom, you have to understand this in order to stay on the ketogenic diet. Here's what I'm trying to do. This isn't just a hoax. These rules are really important. She's a great student, so it was fun to teach her, but in many ways, it was just helpful to me to write down the rules. In one chapter, I do all of this section on what happens. And the major part of this chapter goes through ketones, or the phases of your liver, and cleaning out your liver. This has a lot to do with today's world of healthcare. We have more people asking for liver transplants because they have too much fat in their liver, as opposed to alcohol liver disease. So hepatitis C, right up there with how much fat is in their liver. If they have a fatty liver, which is from carbs, it's not from fat, it's from carbs. If you lower the carbs, you can keep your fat up there. That liver will clean out. Oh my goodness, will it clean out? But you have to do it with low carbs. Why? Because the insulin keeps that, is that hormone that keeps everything locked down in the liver. just like it locks down that extra sugar that's in your muscle. And when that stays present for too long, you can think of it as it gets stiff. It doesn't release to the body as easily. It gets inflamed. And so then it gets kind of this rind around it, then it gets cirrhotic, and that's what happens to chronic liver disease. So she's asking, well, doc, how do I get my liver better? Number one, get your insulin down. So again, if I ask people to do this overnight, they can fail because there's so much shifting that goes on in the chemical side of things, and they can't see that. They can only feel it in their, I feel terrible, doc. This diet's awful. I feel awful. I haven't felt this badly in 20 years. Like, no, hang in there. When the liver is measured each morning, when I have patients tell me their morning glucose and their morning ketones, what I'm really doing is I'm assessing their liver. And when the numbers are higher, they're like, but doc, it's so much better later in the day. I'm like, yeah, I know. But what I really want to know is how clean did you get your liver overnight? Because that predicts the chronic health problems. That's where we get to say, is she igniting autophagy? When people say, when should you check your Dr. Boz ratio? What I want to know is what is it in the morning? Because I want to know how well did they empty that body? And again, you can say this in a way, how well did you stress the body? When you stress the body by emptying out all the sugar, that's when these little storage pockets of glycogen need to open up and let go of their fuel. And we don't want this stagnant. We don't want that sugar hanging out in the liver for 30 years. That's cirrhosis of the liver. We don't want that sugar hanging out as glycogen in the muscle for 30 years. We want you to recycle it. We want you to use it up, take away that little storage unit and fill it up tomorrow. That is a healthy metabolism. It's called gluconeogenesis. We'll get to that at a later time. So this lady says, how do you do it? Okay, you lower your insulin. Well, how do you do that? Well, you start with 20 carbs per day. You're like, yeah, I already do that. Okay, I really want you to track again, because what I've seen is the drift. Patients will have a drift of their carbohydrates, just like anything. Doc, I exercise 10 times in a month. But have you checked that in the last couple of months? And then when you exercise, is it really intense or is it not? So just check your carbs. Go to one of those little apps. I really like the one that has the pig on it, the Keto Stupid Simple or Stupid Simple Keto something. It's just easy. It's free. And it's not having... Scroll to the bottom of the questions about cyclic keto. Oh, hey, there's a good one. I have one that I'm supposed to do at the bottom. So my helper is saying, focus on something. Okay, let me finish the liver and then I'll go do the cyclical keto one. Okay, if you look at how much her liver is empty, it is based on insulin. So when that liver is doing well, the morning sugar will be in the 80s, in the 70s. That's normal. The ketones in the morning will be higher. You're using your fat storage for energy. So that Dr. Boz ratio will be under 80. If you're not doing that, it's that liver timer that I talked about earlier saying, okay, the morning liver wakes up with enzymes after that cortisol surges and the body starts to churn. You'll have a powerful starting block in your liver. That is your metabolism. Now, even when you're fasting, the liver still does its job. The key was how long of a rest cycle did you give your liver each day? To empty out your liver is a fasting cycle that starts with just 10 hours a day. I mean, people say, doc, I've fasted 72 hours. I'm like, okay, if that's the one time in your life you do that, it's not really, that's a good job, but that's not really the point. The point is the steady control of what the liver does each night. Does it get emptied each night? And that's really where this metabolism gets to be the strongest. It's also more sustainable. When people say, I do an 36-hour fast, I do it 3 times a week, that's great, but you check with them in a year and they're usually not doing that. If you can say, I stop putting food in at 6:30 p.m. because I wake up at 6:30 a.m. and that's a 12-hour no zone, zero, except for your birthday or something. Really take on that no zone, and that's how you clean out a liver. What is more important in that question she asked is, how do you check it? And that's really where this glucose and ketone monitor are very valuable. All right, so there is something way at the end, I've been told. Hang in there. Okay. Let's see. Here's a couple of them. I'll just read them out loud. Can we do keto without a gallbladder? I did a whole video on this because that was such a common question. So I would have you go look at that video. I want to find the one with carb cycling. Ketones. Okay. Are there ketones in tablet form? I'm actually trying to produce those right now because I think that's a great idea. And somebody just got their BHB yesterday. Again, that's a really, thank you. It's supporting this channel. It's really helpful for me. Okay, my husband's ketones are 3 millimolar. My husband's been on keto for 3 months, and his blood pressure goes very high, then very low. Okay, so that's actually very interesting. So I'm going to guess that if you have high blood pressure and you're checking it, you're probably over the age of 40. If you look at blood pressure that fluctuates on a ketogenic diet, that is a fluid that's going up and down. There's a few things that I like patients to do on their own so they can see, do you have excessive fluid in your body? And so I'm going to do a little teaching thing here online, or you're going to have to look carefully at the camera. I hope this works. Because one of the best things to check in a ketone in a body that's having fluctuating blood pressures is, are you doing it? And that has to do with how much fluid you're putting in the body and how much your kidneys are able to come out. In doctor speak, we call this heart failure. I don't want to scare you, but this is one of the best ways that I check for heart failure. And so I'm going to use my hand here, and there's no swelling in my hand, but I want you to notice something. If you take your thumb and pretend my hand is your shin, and you're going to take the thumb and you're going to, see if I can do this. You're going to push on that thumb, and I'm not pushing right now, but see the end of my finger, how it turns white when I push? And you're going to push for 30 seconds. Now remember, you're doing this on the shin bone to your leg. And see how those capillaries in my thumb are all white? It's because I'm pushing hard enough to not let the blood flow through that capillary. And you're pushing for a full 30 seconds. And then you're going to lift up, and I'm going to show you my hand that doesn't have a dimple in it. Okay? Your shin bone should be the same. And if you have a blood pressure that's fluctuating up and down like that, and you do this little trick, it's the 30-second shin bone. And usually you have to push hard enough that somebody else should be pushing on it for you. But if you're brave and you can do it, you want to just make sure you blanch those capillaries at the tip of the thumb, and you push for 30 seconds. This is how it's how we use physical exam. I know it's this old thing that doesn't require radiation or any kind of testing, but you check for heart failure. And what it is there should not be fluid between the cells. So your cells should be fitting together nicely. If there's no inflammation in your body, they are tight. When water gets between them, I mean, again, that's not water in the blood vessel system, that's water between the cells. That means there was so much water pumping through the hoses of your body that it seeped out into your legs. We call it edema or swelling, and you have a sock line on the base of your feet or on the base of your leg when you take your socks off at night. All of these are a sign that your heart failed to get all the liquids pumped to the kidney, and the kidney pulled out enough water to keep your body balanced. Your body said, forget it, I give up, I'm just going to stuff this in between cells. It's a very dangerous sign. And I would contend that the person whose blood pressure is going up and down on keto is they're doing really well on keto, and then they're having a sugar substitute, so their sugar goes up. And then they're doing really well on keto, and then their sugar goes up. Because the blood pressure process that I go through when somebody is on keto, first of all, they have to be checking their blood pressure at home. It happens so quickly that you can't say, see me in a week and I'll tell you what to do. You'll be on the floor passed out. I have taken one patient off of 5 blood pressure medicines in 4 days. And it was because they were hardcore. They said they were going to do keto. They were coming to group, and they said, I'm going to cross the threshold now. And I said, wait. How many blood pressure medicines are you on? And he was on 7 blood pressure medicines. Like, all right, here's what's going to happen. You're going to text me these blood pressures because I'm going to help you get off these meds. He got off 5 of them. He was on 2 of them. He's had heart troubles for a while. But the point I'm making is that this happens really quickly when you give your kidneys a break. When you stop eating so many carbs, and then that insulin gets to go down, the sugar is being used as fuel finally, and you are going to have a diuresis, a lot of fluid come out of your kidneys. You're going to go to the bathroom more. So that's a really good question, actually. So thank you for typing that in, because I've had that many times and never had the chance to explain it. So now I can send them to this video. All right, let's keep going here. Let's see, I kind of got out of order, so I'm sorry about that. Okay, so there is one. Let's see. Wild blueberries, are they good for detox? No, there's too many carbs. Um, let's see. Carb cycling. Here it is. Okay, I finally found it. Carb cycling. She should menopause women carb cycle? The answer is no. Now, let's see if I put that carb cycling one in here. I don't know if my assistant's name is Jack, and I don't think I put that slide in here, Jack. But the carb cycling one, I'm going to do a video on this. So actually check in next Friday because I might use that as the lead case for next Friday. There's a lot of misinformation out there, and I just really want you to check your numbers, the ketone glucose ratios, and save those questions for next week. All right, so there is one number here that says, okay, FORACARE ratio doesn't, that's supposed to, okay. Thank you for telling me where you're from. All right. So, yeah, this is great. So this doctor here, fellow family practice doctor, love your stuff, Dr. Bosworth. You're helping me and my patients with real freedom. That is probably my favorite part of what this channel has done, is I have had so many physicians reach out saying, I use your videos to teach my patients. And like, make sure they buy the book. This is really, I love doing this, and I think the audience is amazing. Here's a guy. I'm on keto for nearly a year and got rid of gout, irritable bowel syndrome, hypertension, reflux, improved my allergies, and his psoriatic arthritis. So I'm going to talk about that because there was a couple other questions about constipation and bowels. And it is a powerful process that you go through when the ketogenic diet first starts. I was talking on about, there's a gal who reached out, and we've been doing one chapter at a time on Facebook, just talking about what the chapters cover. And last night we covered the part where my mother ends up with a colostomy bag. And I was saying, yep, for many years I would threaten my children that if they didn't eat their bran muffin, they were going to poop out their belly button. So I'm like, I did that. But they were great because all my son ever, so I'm retelling the story over this last bit. They're now 12, 15, and 18 years old. And they said the only thing I ever knew about a bran muffin is that it prevented pooping out your belly button. And they had no idea what that meant, but it was a colostomy bag I was talking about. So when I came home from the hospital and said, Grandma is pooping out her belly button now, they said, oh, Mom, she didn't eat her bran muffins. Like, close. What it gets to is bowels and their dysfunction is what I was trying to get at. And for the first 20 years of my practice, I did exactly what these guidelines told me to do, which was push fiber, push fiber, push fiber, push fiber. And there was the fiber, and it's lowered to less colon cancer. And so I would promote that. I would talk about how important it was. I would say, okay, if you can't eat that much, supplement it with soluble fiber. And what I didn't realize was every time I was doing that, you were increasing their insulin, because that soluble fiber still has an insulin response, which I did not know of until I started experimenting. But there's been a couple of lectures that I've seen Dr. Westman give, and just talking about that is a real insulin response. And that's why playing the games with partial carbs versus or net carbs versus total carbs is a little dangerous. When you look at irritable bowel syndrome, though, that leads to the first thing people say is, Doc, I'm on this ketogenic diet and I'm constipated. You're like, okay, let's do constipation. So constipation is related to the bowel's ability to send a wave of muscle signals down a hose, essentially. So think of it as this wave that goes down the hose, and one set of muscles talks to the next wave of muscles, talks to the next wave of muscles. I'm going to give you some examples to just make sure you understand that. When you get constipation, the wave got broken. The wave is not moving. So now you're stuck. And then this little tiny wave comes along, but it runs into a a big mass of stool, and it can't send that wave through without a little help. So get them a stool softener helps. Get them a drug that flushes water back into the bowel. Drinking, sometimes we flush water up from the bottom side, okay, called an enema. So all of those would work. But one of my first jobs, I was a farm kid, so I had no role models that were doctors. And so I said, well, I'm going to go work in a nursing home to see if I even like this field. And not sure how I made it through that, but it was a great learning curve. I took really good care of my teeth from then on, because my job for the first year was to make sure everybody's dentures were cleaned. But the second thing that happened was you had to track people's bowel movements. If they didn't have a bowel movement for a while, you had to make sure and help them. And one of the things I was the nurse's aide, and so we would give a massage to our folks at night, just a back massage, and rub lotion on their back. But if they were on the bowel list, we also did something called abdominal massage. They used to, so I thought this was the strangest thing ever, went to the library and went to the books on nursing and said, what is abdominal massage, and why does it have anything to do with their bowels? Because nobody could tell me. They just said, they're on the bowel list, you need to rub their abdomen. And so the point of the trick was to actually push hard enough on their abdomen that you would push on the muscle, and you would push on the muscle and it would trigger a wave. Well, so I went from actually like just rubbing lotion on their abdomen to actually massaging their bowel, doing a true bowel massage with enough pressure, and it moved the stool along. I mean, that we had to switch to doing those in the morning. The point of this is that when you have constipation on a ketogenic diet, you are having troubles with the wave of the muscle getting all the way down to the rectum. So when you've got this problem, you used to solve this with fiber. So in a ketogenic diet, not only is the fiber associated with so many carbs at first that they get constipated, that if they did eat enough carbs to reach the fiber needs, they shove themselves out of ketosis. So in order to get your bowel back in shape, and I really mean that, it wasn't an accident that I told you that story about pushing on your abdomen enough to move the bowels. That's one way to just biohack your system when you have constipation. But the other way is that your bowel is used to being stretched to trigger that the wave to begin again. So if the wave passes to the next wave, you're perfect. Life doesn't tell you about constipation. But if the wave passes to the next wave and then runs into a large amount of stool, it will stop until it gets so stretched that then it starts to spasm and trigger. Well, that hurts, but that is a sign that your bowel also needs to be in better shape. So what's the answer? Okay, the best solutions I've had, because I've run into this, I've done this a couple different ways. This is my favorite way to solve it on a ketogenic diet as of right now. So chia seeds. Chia seeds are these little bitty seeds. They're kind of like tapioca, that if you put them in fluid, they bind up and they get kind of gelatinous. So chia seeds, I have them take a tablespoon every hour. And they're dry chia seeds, so sometimes you kind of have to like chew it, swallow it down, and then you're gonna have to floss because they're gonna all get stuck in your teeth. But you do that every hour, and guess what? You're gonna add a little bit of chia seed to that bowel. It does not cause an insulin response, and it does cause swelling. And that is how your bowel has been working. If you are on a ketogenic diet and you haven't really struggled with constipation before, but now you do, it's almost always because the amount of fiber that you're taking in is lower. That decreased amount of fiber, it would stay in the bowel and your body would suck out all the carbs. So let's put chia seeds in. And this, again, even if you have diverticulitis, I would still tell you to do this because you're going to take this with water. You're going to swell up this little mass of chia seeds, and it's going to be this gelatinous hose that comes through. You'll know when it comes out the other end. But you're going to do this every hour while you're awake, and then you're going to keep doing that the next day, and you're going to keep doing that the next day until you start having a couple of bowel movements that feel normal to you. Then you're going to back down to 1 tablespoon every 4 hours or 1 tablespoon every 3 hours. And you're going to do that for 3 or 4 days. And then you're going to back down to 1 tablespoon every 6 hours. And what you've done is you've put you've kind of reset the bowel so that you're not constipated. You did it without adding a whole bunch of carbs to your body. And you also are getting your bowel back in shape. It's again this muscle that passes on to the next one, passes on to the next one. That wave is really important for your system to increase the strength of those muscle fibers. And if you've been depending only on fiber to move those stools along, you're going to have a tough time with a ketogenic diet. I would contend that the harder patients to solve, because this lady said she got rid of her IBS, the harder patients to help are the ones who have massive diarrhea when they go on a ketogenic diet. They put all these fats in, and their bowel is so not ready for that. Again, when you put fats in your system, two major things have to happen. The pancreas needs to secrete some enzymes to break down the fats in a way that you can absorb them, kind of cuts them up. And your gallbladder needs to squirt out a bunch of bile. If you don't have a gallbladder, your liver needs to add a bunch of bile to the equation so that you can absorb these fats. That does not happen overnight if you've been on a low-carb diet. That will take you several days to even weeks to get the enzymes high enough for this high-fat diet. It will take you days to weeks to get your gallbladder back in shape. I mean, I've had people have gallbladder attacks because they were eating so much fat. And again, the gallbladder's a muscle, so the muscle has to squeeze every time you eat fat. And if you eat no fat for 10 years and your gallbladder's kind of like out of shape and full of scar tissue, and now you're asking it to really squeeze every day, that's like going to the gym and asking you to bench press 3 times your body weight every day. You're going to hurt yourself. So this is the part where if you haven't bought the book, I definitely want you to buy the book. That will go through some of the steps here, which is start your first week with removing all calories from liquids. Again, this means no sugar pop, no sweeteners in your drinks. Your drinks become a place that you do not get sweet tastes from. That's really hard, so that's why I have you start with that one. Just work on that one. Once you master it, once you do that every day for 7 days, then you start taking away carbs from the white stuff, the breads, the rice, the pasta, the potatoes, all that stuff. So those two things will naturally increase your fat just enough that you have to start waking up those fat receptors. The third thing that happens in a bowel that's got irritable bowel, so we've gone through the constipation. The diarrhea is very much related to how well the pancreas, the gallbladder, and the little cells, the acinar cells that absorb fat in the gut lining, if they're not awake, or if you've had a gastric bypass surgery, boy, oh boy, you find trouble. They have a tough time kind of waking up those cells to do their job. They've been not needed, so they're kind of dormant in like hibernation. To wake them up, it needs a little bit of energy. It's like you got to keep giving a little bit of fat. What will happen on the other end is you're going to have diarrhea. You're going to have stools that have oil in them. And that can be an alarming symptom to a doctor if they don't know that you've drastically changed your diet. If you're still having that problem by the end of week 2, then you're going to want to see your doctor. So be careful of that. Irritable bowel syndrome, I contend, is the bowel lining of your gut has become sick. Your bowel, there should be a slime layer that lines your bowels that kind of protects your food, the food bolus from the lining of the bowel. And this gets better with a ketogenic diet because of your immune system. This again has to do with decreasing the inflammation. You say, well, doc, how do you do that? You decrease the sugars, you increase the insulin. This makes it a lower Dr. Boz ratio. And as you look at a Dr. Boz ratio of 40 or less, that is a absolute correlation to the kind of recycling in the body called autophagy that would help with an irritable bowel syndrome. I don't think it would be a strong enough Dr. Boz ratio to help with somebody who's got severe cancer. You're going to want to be under the care of a doctor if you're doing that kind of intense treatment. But when you have irritable bowel syndrome, you're trying to reset the lining of this gut. By adding fat, by decreasing carbs, you are changing the chemistry in that biome so much that the bacteria that used to live there are almost all of them going to die off. And the ones that are kind of like, we've got two little people of our colony left, they are the ones that are going to start to flourish. you will see a significant shift of the biome in your gut just by being keto. That means they didn't add any supplements. They didn't add any, give me the new bacteria. I want a bacterial reset. And although there's some validity to some of that, even just going ketogenic dramatically changes how that biome looks and how it grows. Wow, that was a long section on guts. All right, let's keep going here. Let's see if I can find another couple good questions. What's our time? So we've got about 7 minutes left, and that will take us to an hour. I have... okay, so I have a couple people who... So I have this Sarah S. and she goes, so keto diet can be dangerous diet to do. What age is safe to start? Okay, that is a perfect place to end. There's a whole bunch of other things about green smoothies and magnesium that I would love to get into, and I will have to just try to do those offline. But we are going to answer this question because I think it also leads into the playlist that I'm starting with Kylie, who's the young woman who's pregnant, and she is doing a ketogenic diet in pregnancy. But did you know that you were born ketogenic? That your body was living off of a high-fat food, and until you started eating formula, specifically some of the formulas that have 50% carbohydrates, you were ketogenic. Breast milk is ketogenic. It is a high, especially if you've got a healthy mom who's got, we all know this, if you've breastfed, you look at how well the jar sits out after you've pumped, and you're like, oh, I'm like 2/3 fat. That's a good sign for your baby. That's filled with those antibodies and the proteins that your baby will survive off of. When you look at a ketogenic diet, I always remember my babies when they were breastfeeding, and the stools were low in smell, and they never got constipated. It wasn't until we introduced formula that they had some struggles with constipation, and it is another sign of that slime layer along the GI system, but also that anti-inflammatory effect that happens in kids is powerful in how much it impacts their growth and their mood. So I'm the mother of 3 sons, and I have not had them on a ketogenic diet their whole life, but starting 4 years ago, or about 3 years ago now, the only thing they get in our home is a ketogenic diet. Does it mean that they never have glucose? No, they're kids. They'll have treats and stuff. But one of the powerful things that I've learned is, and especially this last conference I went to, I spent a good deal of time speaking with some psychiatrists that say, you know what, I won't prescribe the ADHD medication until the family has at least considered the ketogenic diet. It is such a powerful predictor of a child's mood that swings up and down based on what their glucose is. That the amount of carbs we're putting in children in one meal is more than they should be having in 3 days. And then you live today in a can of fruit juices and chocolate milk and Gatorade, athletic sports drinks. All of those have turned into a place where we constantly add glucose to their system. And just like in our bodies, they get to put that stored glucose in their liver and in their muscles, but they never get to empty. And it isn't until they produce ketones that they start to come to the empty side. Do they need as strict Dr. Boz ratios as my patients with chronic illness? No. But do I have a fear that using a mostly ketogenic diet for my kids is dangerous? No. I have an organization here in town where the mom has a child with type 1 diabetes. The name of the organization is B83, which stands for the average glucose for a child should be 83. That means average, bell-shaped curve, average 83. And she has created an organization to help other type 1 diabetics, her son is type 1, to learn about the ketogenic diet and learn about how to cook and to live and why it might be better for their brain development as well as their mood. And oh, by the way, her sugars are fantastic. She has an excellent control of her diabetes. But boy, did she fight the whole medical establishment when she went to use a ketogenic diet in a child. I would ask Sarah to say, what makes you say a ketogenic diet is dangerous? And for that danger, I think you're referring to when the ketones go way high. It's called ketoacidosis. And it's actually this type 1 diabetic who's at most risk for that. His type 1 diabetes is when his sugars go way above 200, and his ketones do that too. And I do a really good job in the book of explaining what that is and why you should be worried about that. And if you have a healthy insulin producing pancreas, you shouldn't be worried about that. If you have fat that you can pinch in your middle, that's where I want you to tune in and see, could a ketogenic diet help you? And my answer is absolutely. So I hope that answers that question. I have a ton of these to get to, so I will do that offline. And I want to say that this has been an incredible success. So I do think I'll do this again. I think I'm going to start setting a theme, because next week, if we do the cortisol, the PCOS, the female hormones, the carb cycling, I have a lot of male athletes reaching out to me asking about the carb cycling and the growth of muscles. And I've got a couple of slides that I've made for those that I'm really interested in sharing. The data is out there. It's just translating the data and putting it in a way that the world could understand, that I feel I've got a passion for doing, and it seems to be received well. It's really helpful to me. I've not been a YouTuber in the past, but I've clearly grown an audience, and I am trying to change this healthcare world problem. In America, we have one of the worst situations in front of us, which is baby boomers that are all overweight. And what is about to happen to their brains, again, that's where my focus is their brains are about to age rapidly. We need their mitochondria to wake up. As we do that, I believe the best way to do that is a ketogenic diet. So we're going to use some themes. The next time I put a Q&A, I'll try to have that theme in the title. But I just want to say thank you so much for being such a great audience and having the strength to just bear with me with technical issues, and knowing that I didn't get to all your questions, but I appreciate the audience and the questions. So I am Dr. Boz. I am helping your health one ketone at a time. I would love you to share this with other people. And if you haven't bought my book, please support this channel and buy the book. If you have bought the book, I would love to see your Amazon book review. Signing off, Dr. Boz. Thank you.